Hi, good morning. This is Dr. Robert Chao reporting live for Room Now from ACR22. And today I wanted to share an interesting abstract on very hot topics in the world of gut and microbiome again in spondyloarthritis. And this is abstract 0868. And it focused on, can we alter the neonatal gut microbiome to potentially prevent spondyloarthritis, or at least how does that affect the development of spondyloarthritis? We know there's been a growing body of literature suggesting that alterations in intestinal flora can affect the pathogenesis of spondyloarthritis. And as we know, the most critical time in gut flora formation is the neonatal formation, where it transforms from really this kind of sterile environment to a dense and diverse colonization. So this was a retrospective study examining perinatal factors known to affect neonatal gut microbiome, including the mode of delivery, the choice of early diet, antibiotic exposure, and maternal smoking. Overall, 59 patients were studied, and they found that patients with antibiotic exposure were actually 6.2 times more likely to develop spondyloarthritis. And this association further increased with a greater number of antibiotic courses. Ironically, they found the other factors did not affect spondyloarthritis development at all. This included a mode of delivery, things like vaginal versus C-section, early diet, which I thought was very interesting, including breast milk, formula, or TPN, and even smoking, maternal smoking did not show a difference. I think this is very interesting data, obviously. Looking back on it, we know this is a small study and it is retrospective. And I think to us, it makes sense. I think all of us understand that antibiotic use can alter and change the gut microbiome. And I think for us as clinicians, one of the most important things or the questions I always receive from patients about gut microbiome, I think is because I feel like inherently to us as people, we feel like the gut microbiome is something we can control. And I think to patients, that's very important. Besides them coming in every few months, getting our blood work that we recommend, our medicines that we prescribe, patients want to have a sense of their own control over their disease. And I think gut microbiome and diet is one of those areas. But now looking at this data, is this something that we can control? Because when we get sick, and if we get sick, do we not take antibiotics then because of this study? Obviously, I don't think that's the right choice. I think there's a few things to consider. Maybe in the future, if a pregnant patient is sick, should we be more judicious with antibiotic use? Maybe don't give everyone who has a sneeze and a cough and a typical upper respiratory infection a Z-Pak. Maybe there should be a role for probiotics when prescribing antibiotics to pregnant patients. I think these are all interesting questions. And then this study was definitely very interesting in shedding some new light on the world of gut microbiome and spondyloarthritis. So thanks for tuning in. For continued coverage of ACR22, please tune into Room Now and follow me on Twitter at Dr. RBC. Thank you.